Good morning. This is Rohan Tripathy. I'm the founder of Inovocare Healthsoft Solutions Pvt Limited. Now, if any of you follow cricket regularly, you would have seen that this year during the IPL auctions, the auctioneer Hugh Edmundis had a fall, had a blackout and fell down. That is one of the symptoms of autonomic neuropathy. That is what we are trying to diagnose here. If you see that autonomic neuropathy has not one but many symptoms that tremendously degrade the general quality of life, and this increases a lot when you have diabetes, when you have old age, and even with some diseases like long COVID. So what we are doing here is we are recording your body's response when you are performing certain activities like change in posture, when you are doing activities like sustained hand grip, when you are doing a Valsalva maneuver, and we are comparing it with the medically set parameters results. We are following the Edwings et al. That has been accepted by the medical fraternity globally. The way we entered working into this was we had developed a very simple prototype of a head-up tiltable test for one of our mentors, Dr. Shaman's Dutt, at the School of Tropical Medicine, Kolkata. Upon setting this up, we found out that the diagnostics required with that simple seesaw-like head-up tiltable test were severely lacking. After understanding that, we went to a lot of doctors for people involved in the medical education fraternity, and there we found out that a lot of doctors, they are saying, when we are asking them, do you think your patients, especially the diabetic people, must have this test done? They are saying yes. Then we ask them, how many of your patients have done it? Then they give us a smile. That's why we critically understood and tried to understand why this test is not happening. We examined the existing devices in this who are doing this partially. We found that one of the issues was the price was an issue, accessibility was an issue. Another issue was these devices are very bulky devices where the software runs in a separate PC or computer. That you can understand increases the price by 60,000-70,000. And if you think of the range of this problem, in India, the diabetic numbers are not a surprise to anyone. Even the elderly boom is absolutely at our doors. So that's why we think this is the time to look into this product. It's not about what I think, it's what the American Diabetes Association recommends. They are saying that for everyone with type 2 diabetes mellitus, everyone should have periodic testing of autonomic neuropathy. And even for the elderly, this is also critically required. Even these days, the doctors are saying for people who are rehabilitating or recovering from stroke, the stroke patients, to understand the quality of rehabilitation, this is required. Even these days, they are saying, the medical science is saying that for the sports people, because the sports people have to go through a lot of checks to see their physical fitness is at the best levels. You can perform a yo-yo test to get your external fitness done, but what about your autonomic neuropathy? So for these responses, it's essential to have tests like this. Currently, we have completed the individual parameter testing successfully with a very positive result. We have received the bioignition grant, and up next we are heading towards the testing in the medical clinical setting with near about 100 patients in a hospital with a medical supervision. Currently, what we are planning to do is enter near the commercial stage, gather as much as data from the grants that we have raised using BIRAC Big and initially NIDHI PRAYAS. Once we have sufficient data, then definitely we will require a lot of funds, because for a medical device, the clearance and the diagnostics, and we don't want to be restricted only in India, so the international licensing also will require sufficient amount of money. There was a lot of interest, not only from the doctors, but also people in the medical research community. They showed significant amount of interest, and they even, as we are taking some time developing it, I frequently get contacted and calls like, how far are you? Have you done it? Like in this upcoming 14th November is the World Diabetes Day. So yesterday only I got a call from one of the doctors who is one of our biggest supporters. Like, let's have a screening with your device on that day. I say, just wait a little, let us get some momentum, and then we will proceed. It was absolutely great attending the IKMC 2022. I have been here previously in IKMC 2019 as well. Last 2 years I attended the online versions, but being here physically, meeting the who's who of the medical innovation community, it has been just awesome. And also meeting a lot of my mentors here also. So it has been a great learning experience.